some of the challenges that foster care families Okay, so I'm going to go over some of the challenges that foster care families face. Children who are placed in the foster care system are often victims of abuse, neglect, trauma, or another bad experience when they enter the system, and they're likely to exhibit behavioral issues due to a lack of trust and poor emotional regulation. So this also presents a challenge for foster parents, as they are also living in a high stress environment and navigate the emotional needs of various children. The foster care system does not do a good job of providing stability for these children, as they might be moved around often and without much notice. And children that are dealing with trauma benefit greatly from stability, so this is a pretty big flaw in the system. This instability can impact the child's academics and cause unhealthy attachments to caregivers and teachers and unstable relationships in their lives. And there are also financial stressors that are placed on foster parents, because the system does provide stipends for these parents, but it doesn't always cover all of the needs of actually having another child in the home. Now I'm going to talk about how we can support foster care families as teachers and educators. First, it's really important that we build trust with the family, that we are reliable to them, and we can be empathetic and predictable so that they feel safe in their environment and the child feels valuable. And we can use positive reinforcement with the child. We can also provide resources, so that includes trauma-informed care, where we can understand triggers and responses. We can offer emotional regulation strategies and just be calm with them. And we can offer mental health support resources like therapy or counseling. We can communicate and work together with parents, biological families, caseworkers, teachers, etc. By being clear and respectful and communicating often, like regular team meetings. We can have shared decision making with these influences and be supportive in the reunification of the biological family, and encourage positive visitation experiences and healthy parenting behaviors. We can also address their educational needs as they are in the foster care system, like giving individual support plans or tutoring or mentoring programs. And as Christians, we have a very unique position, and we are able to offer these children a new perspective that they may not have access to, which is to Jesus. So there are many ways we can integrate our faith into our daily lives as we work with these children and families. We are called to be lights in a dark world, and we know that God will equip us to do so. So by being a source of kindness and safety to the families we work with, we can stand out and plant seeds, encouraging them to look beyond worldly things for peace and joy. We can be generous with our time and resources, always willing and ready to help with an open heart and give more than what is asked of us. It's also important that as Christians we do not pass judgment on any of these children or families just because they are different than what we might be used to. We should grow comfortable being uncomfortable, always seeking to serve the Lord and please Him in everything that we do. Although a lot of schools do have standards about discussing religion or the approach of religion, we can speak biblically to everyone we encounter and encourage daily themes that reflect Jesus' love for us. So the first source that I found was a peer-reviewed article. I was unable to interview anyone for this assignment. So I found a peer-reviewed article about foster care and mental health. There was a survey of nearly 100,000 children 0 to 17 that examined the relationship between foster care status and mental health outcomes. And those who were in foster care were found to have a 95% higher risk of developing mental health issues such as ADHD, depression, anxiety, language disorders, and they had an overall more negative mental health. And it compared children in foster care to those who weren't in the system, which showed the major differences in a child's mental health and emotional well-being when they are in a stable family. And then the second peer-reviewed article that I was able to find talked about the foster parent stress and how it impacts the foster child. So there are 432 foster children aged 4 to 17 looking at the foster parent stress, predicting foster children's mental health outcomes, and highlighting how family dynamics matter in foster care settings. And it can help us discuss how caregiver stress is a challenge and why support strategies are needed.